No matter how great government benefits and services are, they mean nothing if they don't reach the people who need them. And that's where faith and community groups often play an invaluable role. Whether it's a flu shot, veterans benefits, or job training, government does well when it seeks community partners to try to reach those people who are most vulnerable and who need those services, and make sure that those people know about the services and can actually access them. Because if that doesn't happen, it doesn't matter what kinds of benefits and services are offered. They have to meet the people who need them.
What would our community look like if we had the lowest teen pregnancy rate in North Carolina? What would our community look like if we had the lowest rate of sexually transmitted diseases in North Carolina? What would our community look like if we had the lowest rate of violence against women in North Carolina? What would our community look like if we became the healthiest community in North Carolina? What would this mean? Lower obesity rates, lower hypertension rates, lower abuse rates? How can we improve providing health care to women, both access and quality? What would this look like? How can we think outside the box to make a difference? How can we educate our population to create a healthier community? What needs to change? How do we work together? Who is not getting care and why? What can we do as a community to improve the health of women? And as we improve the health of women, we improve the health of the entire community.
What I understand is that the strength of my organization comes in with community buy-in. So for the fact that if we do not engage the community, and if I do not participate in events such as this to try to educate people on the fact that there is a crisis, nothing short of a crisis going on in Greensboro right now, then our project will not see the maximum potential that it can actually occur in the city. So, for example, we're tied second with New Orleans for food security, or insecurity rather. And I don't remember Hurricane Katrina coming through Greensboro, so I'm trying to figure out how far down the pipeline have we got disconnected from our food source. And this is a generational thing. This is a low-income, high-income thing. Nobody's exempt to, no matter what your occupation is throughout your day, you have to eat at some point in time of the day. And what we're finding out is, the poison and the medicine all diverts back to the food. So there's no way around it. And for us to have these food desert areas in an agriculture state where we have, North Carolina A&T right down the street and North Carolina NC State up down the street,
When the health care law was passed in 2010, it was the first major overhaul of the United States healthcare system since 1965 when Medicare and Medicaid were passed. But what that did for many Americans after the age of retirement is it provided that safety net. They have health care available to them regardless of what their health care needs are. And it is a system that they have invested in through their years of work experience. And once you reach the age of 65, you are Medicare eligible. You get Medicare. You get coverage. If you are a Medicare recipient, you are already in compliance with the law. Do not go to the marketplace thinking you're going to find a better plan. You are not, and you are not eligible to do so. Do not allow someone to call you and say, hey, I know you receive Medicare, but there's a better plan out there for you on the marketplace. That would be fraud. And we are very concerned about fraud among older adults, particularly medical fraud. Through our research, we know that older adults are making choices. They are making life-altering choices. Do I pay my electricity bill, or do I buy this prescription? Do I purchase food, or do I pay my rent? Every decision is a life-changing decision. And one of the advantages we see in the Affordable Care Act is it begins to decrease some of the seriousness of those decisions that people have to make once they're 65 and older. Do some homework, read, ask questions, attend other conferences, find out what the law means to you, because I guarantee you it impacts you or someone you care a great deal about.
Why, in your opinion, is there so much opposition to the Affordable Care Act?
So there's a political discussion that's up here that's very intellectual and cerebral and political. And then there's the real life that a lot of people are living, which is they want insurance and they need a way and they need the help to get it. And again, I need your help telling them. Thank you.
We need to educate our community citizens through the church and other venues where they trust people. They trust your congregation trusts you, to tell them what they really need to know. But I'll tell you what the real reason is. It's greed. Can I get an amen to that? It's amazing to me how certain things get through Congress and certain things don't get through Congress. And I am not political. I want somebody who's going to do the right thing for the people of this country. And physicians, I being one, I don't throw rocks, okay, because we all fall short. But physicians have been greedy at times. Pharmaceutical companies have been greedy at times, okay. Insurance companies have been greedy, okay. The whole system is broken, and that's why we need to get our arms around it.
So what we mostly spend our time doing now in our political and our rhetoric as it relates to health care is if we're in the side of things that's talking in political terms, we tend to talk about justice or we talk about personal responsibility. If we then go to a church on Sunday or to our synagogue or to whatever our faith-based community is, oftentimes we talk about things that sound much more like charity. Well, what I've come to understand and learn somewhere between 1990 and 2013 is that justice and charity are two faces to the same coin, that a community must be healthy for individuals to be healthy. So the thing that's exciting to me today, as we're sitting here together in a beautiful facility, is I believe we have the opportunity to think far more broadly than we have before, to think about things like the health of community, and to understand that justice and charity are two sides of the same coin.
My question is, my doctor says that I don't have to have a mammogram anymore, and I want to know why.
How old are you?
90.
90? No way.
You are a living testimony to the fact that the longer you live, and you're healthy. I disagree. I think you need to continue with your mammograms. You probably have at least another 5 to 7 years or more.
But first, I want to provide a bit of background for those of you who might not know much about the White House Office of Faith-Based and Neighborhood Partnerships. The mission of the White House office is to form partnerships between the government and nonprofit organizations, both secular and faith-based, to serve people in need. As President Obama has said, the goal of this office is not to favor one religious group over another or to favor religious groups over secular groups. It is simply to work on behalf of those organizations that want to work on behalf of our communities, and to do so without blurring the line that our founders wisely drew between church and state. This work is important, he said, because whether it's a secular group advising families facing foreclosure or faith-based groups providing job training to those who need work, few are closer to what's happening on our streets and in our neighborhoods than these organizations. People trust them, communities rely on them, and we will help them.
But there are three teachings that I wanted to share with you. The first one is from Jewish tradition, which teaches that human life is of infinite value and that the preservation of life supersedes almost all other considerations. Jews believe that God endowed humanity with the understanding and ability to become partners with God in making a better world. The use of our wisdom to cure illnesses has been a central theme throughout Jewish thought and history. The second thing is what Jewish tradition tells us about our obligations as a society to provide health care. Judaism says that we know that communities are obligated to provide healing for all of their citizens. Providing health care is not just an obligation for the patient and the doctor, but for society as well.
What we're trying to debunk is this image of a red barn with the old couple with the pitchfork. You know, that's not what the farms are going to look like now. They're going to take a tremendous shift with this marriage between agriculture and technology that's coming about. And we're really trying to engage young people to know that, you know, it's not necessarily what we always thought agriculture to be. What I deal with is very, very cool, especially aeroponics. If you're kind of a nerd like I am into things like that, where, you know, aeroponics, just for example, you know, it's a system to where you have a air-conditioned system almost inside of your water that blows oxygen to the roots of these vegetables that help them grow in a very exponential rate. And if, you know, from what I just said, I know it kind of sounds like, but if you actually see it, I'm like, oh, that's... So
a lot of our work is involved in this convening function, bringing people together. Now, conveniently for me today, you have done the convening yourself. And so we are able to just plug into what you're doing. And again, that's a great, great blessing for us. Because I often find when we convene these gatherings like this one today, you will be able to tell us how we can do our job better. And that's a great service to us. So this is very much a two-way street, a conversation. And we want to hear from you about how we can do our job better. And we want to work with you so that you can do your job as well as you possibly can.